All right. Hello, everybody. Welcome to another A&P lecture. My name is Meredith Wardell. I am one of the EMS faculty here at the paramedic program. I'm also our clinical coordinator for clinical internship and our paramedic prep coordinator as well. So if you haven't had me before, that's who I am. Today, we're going to talk about transport mechanisms. And by transport mechanisms, I mean the different ways that substances move in and out of our cells. We're going to learn how they maintain their internal environment, how they communicate with each other, and ultimately just how they sustain life. So cells are like tiny, complex factories. They need raw materials brought in, waste products to be shipped out, and products and signals moved throughout. Just like how a factory has dedicated gates and pathways for different types of traffic, cells use specific transport mechanisms to regulate the flow of ions and nutrients, and all other essential molecules across their membranes. So we're going to dive into kind of a fundamental aspect of cellular biology. It's important to understand how cells function and how the human body reacts on a cellular level. So what you're looking at here is a picture of the cell membrane, which serves as our gatekeeper to the inside of our cell. This barrier is selective, so it's controlling what enters and exits. If you watched my previous lecture on cytology, this is what we compared to a bouncer of a club, only letting certain people in. The cell membrane only lets certain things in, and it controls what enters and what exits to ensure that all essential substances like nutrients are absorbed, waste products are expelled, and to help maintain the cell's internal environment. And as paramedics, understanding these transport mechanisms helps us comprehend how drugs modify electrolyte imbalances, so like diuretics, for example, or treatments that we're doing, adjusting to the cellular metabolism and how that works. It's important to know the why behind everything. So we don't just know what we're doing, but we know why we're doing it. And this understanding is not just academic, it directly impacts our ability to do our jobs because we need to know what's going on at the cellular level. So that's what we're going to talk about today. So before we go into detail about all the different types of transport mechanisms, we're just going to do a quick overview of the two main ones. There are two primary mechanisms and how substances move across the cell membranes using these two primary mechanisms. So the two primary ones are active transport and passive transport. Active transport involves the cell expanding energy, typically from adenosine triphosphate, ATP, to move substances across their concentration gradient. So to move from areas of lower to higher concentration. Concentration gradient is also something we're going to talk about later on in this lecture. Active transport is like pushing a rock uphill. It requires energy, it requires effort. Active transport is also essential for maintaining cellular concentrations of ions and other substances that cells need to function properly. And our second primary mechanism is passive transport. So to contrast active, passive transport requires no energy expenditure from the cell. Substances move from areas of higher concentration to areas of lower concentration, following the natural flow, kind of like drifting down a river or like going against the grain. You're kind of just floating. You're going the easiest way. This process is important for just basic cellular functions, like absorbing nutrients from the environment and expelling waste. There's different subcategories within both of these that we're going to talk about, but like I said, these are just our two primary mechanisms. So some definitions to know, some words you're going to hear throughout this lecture. The first one is diffusion, which is a process where substances move from an area of higher concentration to an area of lower concentration. We have facilitated diffusion, which is still a passive process, but it requires the help of transport proteins, which are embedded into the cell membrane. These proteins helps specific molecules like glucose move across the membrane when they can't do so alone. Concentration gradient refers to the difference in concentration of a substance between two areas. Transport across cellular membranes often occurs down a concentration gradient from an area of higher concentration to an area of lower concentration. Equilibrium is what's achieved when the concentrations of all our molecules are uniform throughout. So there's no longer a net movement of molecules in any direction. Osmosis is basically the diffusion, but for water. It's diffusion through a selectively permeable membrane from a region of high water concentration to a region of low water concentration. And then osmotic pressure is the pressure required to stop the net flow of water across the membrane. And then continuing on from that, osmolarity is the total concentration of all solute particles in a solution. It's a measure of how concentrated a solution is, and it's important for determining how water will move in or out of the cells through osmosis. Filtration is a passive process that relies on hydrostatic pressure to force water and solutes through the membranes. It's really important for the kidneys, where blood pressure forces waste and excess ions out of the blood to form urine. Active transport, we kind of already hit in the slide before this. So isotonic, hypertonic, and hypotonic are different types of solutions that we are going to talk about later on in the lecture. Isotonic is a solution that has the same osmotic pressure as body fluids. Hypertonic has a higher osmotic pressure than body fluids, and hypotonic has a lower osmotic pressure than body fluids. And then the last one is cytosol. It's fluid-like material living in cells that is part of the cytoplasm. It's where a lot of the cell's metabolic processes occur, and it plays an important role in transporting materials within the cell. So, like I said, two main types, passive and active. Starting with passive transport, like I said earlier, this is where molecules naturally move across the membrane from areas of higher concentration to areas of lower concentration. This movement doesn't require energy, which is what makes it an efficient way of transporting substances like oxygen and carbon dioxide. So breaking this down a little, like I said, there are some subcategories for each primary category. So the different types of passive transports are simple diffusion, facilitated diffusion, osmosis, and filtration. Simple diffusion is the most straightforward. It's where molecules like oxygen and carbon dioxide move from an area where they are more concentrated to an area where they are less concentrated, directly across the cell membrane. Facilitated diffusion is when molecules need a little help crossing that cell membrane. Might be because of their size, but they just need a little help. So this is where the transport proteins come in, and they help provide a pathway for these molecules to get over. The next one's osmosis, which is specifically for water movement. Osmosis occurs as water moves towards a higher concentration of solutes to balance out the concentrations on both sides of the membrane. And then filtration is the last one, which is driven by pressure differences. It's a process that forces molecules through the membrane, specifically in the kidneys to filter blood, but this is pushing our molecules through the membranes. In passive transport, molecules and ions are in constant motion. They move quickly, they collide into each other, but that's what helps them spread out evenly across the space that they occupy. So one of the ways that I've found that's really helpful for imagining these different types of transport mechanisms is by comparing them to something that we already understand. So for me, that's football. So if you look at this crowded side of the field with all of these LA Charger players, they are condensed, they are huddled together, just like molecules would be. This is similar to the area of higher concentration, the area that has more molecules in one part of the cell or on one side of the cell membrane. Now, if you look at the other side of the field where the Cleveland Browns are, there's not that many, right? there's fewer players. And so this is the area that represents lower concentration. So to show what passive transport looks like, this player is going to just casually stroll across the field to get a touchdown. There's not much that he has to push against, if anything at all. There's not as many players on the other side, the side with lower concentration, so it made it easy for him to go across the field without anything in his way. So our LA Charger that just scored a touchdown moved from an area of higher concentration, the area with more players, to an area of lower concentration with less players. That's passive transport. It was easy for him to get to the other side. So the football is the molecule being transported, and the molecule starts with the player on one side of the field where there are a lot of players representing higher concentration. The other side of the field, like we said, is the side with lower concentration, less players. So to get the football, aka the molecule, from the area of higher concentration to the area of lower concentration, all our player had to do was casually jog across the field because there wasn't much standing in his way. Moving on to active transport. Active transport defies natural diffusion tendencies because it's going the opposite way. It's going from an area of lower concentration to an area of higher concentration. Active transport primarily uses energy from our ATP, adenosine triphosphate, to move molecules through transport proteins within our cell membrane. This is important for helping change the shape of carrier proteins to help facilitate the movement of substances against that concentration gradient. And then our secondary is also known as co-transport, which is a method that indirectly uses energy. It relies on energy that is already stored, which it's stored in the form of ionic gradients, created by primary active transport. Active transport is the one that earlier I compared to pushing a rock uphill. You're going against the grain, against the force, which means you need energy. You need that adenosine triphosphate, that ATP, to get from where you are to where you want to go. So primary active transport, the energy needed to move molecules comes directly from our ATP, our unit of energy. And a classic example of this is the sodium-potassium pump, which maintains the essential ion gradient. Secondary active transport, on the other hand, uses energy stored already and does not use ATP directly. It takes energy from primary and uses it versus using ATP directly. For example, the sodium glucose transport proteins in the intestines use the sodium gradient established by the sodium potassium pump, which we talked about for primary active transport. And it uses it to help bring glucose into the cell against the concentration gradient, against the grain. So now we've looked at passive transport as a football game. Let's look at active transport as a football game. So let's continue with our football analogy. Let's think about active transport in the form of a football team. So imagine one side, again, we have our players here. But now the other side, we're not playing the Cleveland Browns anymore. We're playing the Kansas City Chiefs. And they have a lot more players. The team's goal is to move the football, which represents a molecule, like sodium or glucose, from the region of lower concentration, which is the area with the Chargers on it this time, to an area of higher concentration, which is the area with the Kansas City Chiefs. And that's moving against the concentration gradient. It's moving against the grain. So if you look here, since there's less players on one side, they have more to fight against to get a touchdown on the other side. The Chargers have a lot more players this time around to play against versus when they were playing the Cleveland Browns in our last analogy. So now it's a little harder. Now they're really pushing there and they're pushing towards the touchdown, and they really have to work to get the touchdown. That's active transport, using our energy, using our ATP to get where we need to go because we're going against the concentration gradient, we're going against the grain. So, like we said, the football represents the molecule being actively transported, starting on the side of the field with less players and moved to the side with more players. The energy required for the movement and active transport is similar to the effort and strategic play of that player that we just watched. They're using energy and strategy to navigate through the defense, much like the energy required to move molecules across their concentration gradient. So looking at this chart here, we just have the differences between primary active transport and secondary active transport. Primary active transport uses ATP to move molecules. Typically, a single type of molecule is moved across the membrane. So let's go back to our sodium potassium pump. That moves sodium out of the cell and potassium into the cell, which is important for nerve and muscle function. Our secondary active transport, like we said, instead of using ATP directly, it uses kind of what's left over from that. It uses energy we already have stored. A common example we hear of this is the glucose sodium pump in intestinal cells, where glucose is transported into cells alongside the sodium, which plays an important role in our heart cells, our cardiac cells. Next up is endocytosis, which is a form of bulk transport that involves using the cell energy to internalize substances. So since this uses energy, it's considered active transport. It's considered a form of active transport, a subtype of active transport, because it requires that ATP to move substances in or out of the cell against a concentration gradient. There's two main types of endocytosis. There's phagocytosis and pinocytosis. Phagocytosis, often referred to as cell eating, it's used to engulf large particles like bacteria. And pinocytosis is considered cell drinking, where the cell takes in fluids along with smaller dissolved molecules. So endocytosis as a whole is a process where cells ingest external materials by engulfing them in a section of the plasma membrane, which then kind of pinches off to form a vesicle. So let's dive a little more into bulk transport. Starting with endocytosis, we already said is a process where cells absorb external substances, they engulf them within their membrane, and they form a vesicle, which is important for taking in pathogens or other significant particles that the cell needs to either function or defend. There's exocytosis, which involves the vesicles within the cell fusing with the plasma membrane and then expelling those contents to the exterior of the cell. So this is important for removing waste materials or secreting substances like hormones and neurotransmitters. And then we already talked about phagocytosis and pinocytosis, cell eating, cell drinking. Moving on to filtration. This is a movement of water and solutes across the membrane driven by a hydrostatic pressure gradient. This is different than diffusion or osmosis. Those are driven by concentration gradients. Filtration is used to separate particles from fluids and allow the passage of water, but also retain larger particles. A good example is in the kidneys, filtration happens in the glomerulus, where blood pressure forces water and small solutes through the capillary walls. If you didn't know already, your kidneys and your heart work very close together. And them working together properly, both systems working properly and then both systems working together properly, is very important for maintaining homeostasis. A lot of people think that filtration is active transport because it sounds kind of like it would be, but it's actually passive. It's driven by a hydrostatic pressure gradient rather than a concentration gradient. Filtration doesn't require energy to occur. The hydrostatic pressure drives the mechanical forces rather than using up our energy. You can see in this picture the movement of fluid through this barrier. Water and small solutes are passing through the membrane, while the larger particles are retained. This selective permeability is essential for separating substances, and like we said, is a key function in organs like the kidneys, where blood is filtered to remove waste while still retaining necessary proteins in cells. Moving on to diffusion, This is where oxygen and carbon dioxide are exchanged between the blood and an external environment, like inside the lungs. Oxygen moves from a higher concentration, which is the blue, into the blood, the red, where the concentration is lower. Carbon dioxide moves from higher concentration in the blood to lower concentration in the external environment, which removes it from the organism. Oxygen continuously diffuses from the blood into the cells because its concentration is always higher in the blood than in the tissue cells. On the flip side, because carbon dioxide is in higher concentration within the cells, it diffuses tissue cells into the blood. Cells allow substances to diffuse in or out only if the cell membrane is permeable to the substance and if concentration is higher on one side of the membrane than the other. Diffusion is a fundamental process where our molecules are moving from higher concentration to lower concentration until equilibrium is reached. Over time, the molecules of both oxygen and carbon dioxide will continue to move back and forth until their concentrations are equal on both sides of the membrane, which is known as reaching equilibrium. Diffusion is passive, it's a form of passive transport, meaning it doesn't require energy from the cell to occur. Now we have concentration gradients. You've heard me say this a bunch of times in this lecture already. Here it is. Here's our concentration gradient. These exist when the concentration of particles, like molecules, is higher in one area than the other. The gradient is the driving force for diffusion, osmosis, and active transport. It helps with diffusion by providing the necessary differential that drives the movement of molecules. No ATP is required here because the molecules are just moving downhill. They're moving to the side of the football field with less players. Osmosis, which we're going to talk about here on the next slide, water moves to balance the gradients on each side of the membrane, moving down its concentration gradient. The water potential gradient drives osmosis. In active transport, substances need to be moved against the concentration gradient, which requires ATP. We're moving from an area with lower concentration, like less players on the football field, to the area with more players on the football field, and that requires our ATP, our energy. In cell transport, concentration gradients are fundamental because they're allowing for the movement of substances to help maintain our homeostasis or help get back to our homeostasis. All right, osmosis. It's diffusion, but for water. It's the movement of water or a solvent across a selectively permeable membrane from an area of low solute concentration to an area of high solute concentration. Water moves in the direction that will help equalize solute concentration on both sides of the membrane. It's moving to help maintain that equilibrium, both inside the cell and outside the cell. Osmosis not only regulates the concentration of water in cells, but it also helps in distributing nutrients and expelling waste by controlling the movement of water in and out of our cells. So, for example, in the kidneys, osmosis is crucial for reabsorbing water into the blood from the filtrate in the nephrons, which concentrates our urine and conserves our water. Osmosis is a cornerstone for our physiological processes when it comes to cell transport, enabling not just nutrient uptake and waste removal, but also intricate management of body fluids when we're talking about health and disease. It's a crucial movement to help maintain our homeostasis. So moving to osmotic pressure, that's the pressure that must be applied to a solution to prevent the inward flow of water. Osmotic pressure helps preventing severe osmotic imbalances. So osmosis, like we said, is a passive movement of water across a semi-permeable membrane from an area of lower solute concentration to an area of higher solute concentration. And osmotic pressure is the pressure that must be applied to a solution to prevent that inward flow of water across that semi-permeable membrane. So for example, a solution with high osmotic pressure due to a high solute concentration will draw water towards it, influencing how substances are absorbed and utilized in our body. Osmosis can also have significant effects on the cells, such as the cell swelling and bursting, or the cell shrinking. If water moves into a cell in a hypotonic environment, which is where the outside fluid has a lower solute concentration than the inside of the cell could swell and then burst. However, on the flip side, in a hypertonic environment where the outside fluid has a higher solute concentration than the inside, water will flow out of the cell, causing it to shrink and possibly die. So just to recap here, we have passive transport where no ATP is required. Underneath passive transport is diffusion, simple diffusion, facilitated diffusion, and osmosis. Then we have active transport, which does require ATP. It does require energy. And there's a primary and a secondary and a vesicular transport, which we didn't really touch on. Vesicular transport is the transport of large particles or volumes of fluid via the vesicles that we talked about. It's then divided into endocytosis and exocytosis. This is an essential part of understanding how drugs interact at a cell level, which is crucial for our roles as paramedics. All right, moving on to osmolality, and tonicity. So chemists use moles as a standard for things that are very, very small, like atoms, ions, molecules. It's used to express amounts of a chemical substance. It benefits chemists because it allows them to work within the subatomic world in microscopic amounts. This number down here in the right corner, 602 sextillion, is known as Avogadro's number. A mole is essentially a standard quantity in chemistry, and it just refers to an extremely large number, like Avogadro's number. This comes into play when we're talking about units of mass, med math, pharmacology. Knowing how many molecules are in a mole can help you understand and calculate the exact amount of a substance, which ensures safe and effective interventions. So while you may not calculate this daily, understanding the concepts of moles helps you grasp that basic concept of drug concentrations and interactions, and just puts an emphasis on the precision and the attention to detail that's needed when it comes to medication administration. We kind of already covered this, but again, just to recap, osmolarity is the measure of solute concentrations per unit of volume. Osmolarity refers to the concentration of solute particles that contribute to the osmotic pressure of a solution. It's measured in osmoles per liter and is practical because it's easier to calculate and it's easier to apply, especially when preparing solutions or administering IV fluids. Osmolarity considers the total volume of the solution, which makes it especially useful in scenarios where the solution's volume is known, like an IV bag. We know this volume of that solution, right? If we have a 1 liter normal saline bag, we know that the volume is 1 liter. Osmolality, on the other hand, measures the concentration of solute particles per kilogram of solvent, which makes it more accurate, but it's harder to calculate. Osmolality comes into play and is crucial when we have patients who have an issue with their fluid balances, like dehydration, kidney failure. It helps gives us a more precise measurement of how concentrated or diluted the body fluids are, which can be critical when it comes to appropriate treatment decisions, appropriate fluid decisions. So for example, if you're treating a patient with hypernatremia, which is a high sodium level, knowing the osmolarity and the osmolality of the fluids in our blood can help guide our decision on the type and amount of IV fluid we're going to give. This helps us make sure that we're correcting the imbalance effectively without causing a rapid shift that could then cause cell damage and then cause our patients more harm than good. Tonicity refers to the ability of a solution surrounding cells to change its shape or tone by changing their internal water volume through osmosis. It's crucial to make sure that you know the difference between tonicity and osmolarity. While osmolarity measures the total concentration of solutes particles in a solution, tonicity is about how a solution affects that cell volume. This is also important when it comes to IV fluids. Depending on their tonicity, fluids can cause cells to shrink or swell or remain the same. So now I'm sure you're sitting there thinking, what does this have to do with EMS? Why am I learning about Avogadro's number? Why am I learning about moles? Why am I learning about osmolarity? Well, you've heard these words before, right? Hypertonic, isotonic, hypotonic. I mentioned them at the beginning of this lecture, but now we're going to learn why all of this is important to us. So starting off with our isotonic solutions. This is typically what we carry in the ambulance. Most places stock normal saline, which is 0.9% sodium chloride. Isotonic solutions have the same osmotic pressure as body fluids, which means their solute concentration is the same that's found in the cells. This is beneficial because it doesn't make these cells swell up and burst, and it also doesn't suck water out of the cells. Isotonic solutions don't cause water to move in or out of the body cells. This makes it the safest fluid to give in the majority of our patients. And as you see here, isotonic solution in the middle, where the solute concentration is equal on the inside and the outside. There's no movement of water in or out of the cells. You can see that the cells maintain their shape. They maintain that round shape. Moving next to hypertonic, this is where the concentration of solutes outside the cells is higher than on the inside. Water moves out of the cells to the area of higher concentration, which causes the cells to shrivel up and shrink and possibly die. When cells are exposed to hypertonic solutions, a process known as crenation, which is where cells shrink, occurs. An example of a hypertonic solution is 3% saline. This is much, much saltier than normal body fluids. This is the fluid that's typically locked up in like the Pyxis, sometimes requires two people to sign off on it. But it can be a dangerous fluid to give if you're giving it to somebody who doesn't need it. Hypertonic solutions are primarily used for patients who have excess fluid in their tissues, which can occur from things like heart failure, kidney diseases, and severe inflammation. Another great example is a patient with cerebral edema, which is swelling in the brain caused by excess fluid. Administering a hypertonic fluid can help reduce that swelling by pulling fluid out of the brain tissue into the blood vessels, which is a critical intervention that could potentially save lives because it's alleviating pressure in the skull. So as you see here, the fluid surrounding the cells has a higher solute concentration with our hypertonic fluids, which causes the water to move out of the cells to try and balance that concentration. But that leads to cell shrinkage, and ultimately the cells could die off. And the last one we're going to talk about is our hypotonic solutions. This is where the concentration of solutes outside the cell is lower than the inside. Water moves into the cells because of osmosis, which causes the cells to swell and possibly burst. A common hypotonic solution is 0.45% saline. This solution is less concentrated and more diluted than normal body fluids or isotonic fluids, primarily used to rehydrate cells and tissues. When patients are dehydrated, their body cells are often shriveled due to a lack of water, and administering a hypotonic saline like that can help move water back into those cells, rehydrating them effectively. But it's important to administer these solutions carefully. Rapidly expanding the volume inside the cells can lead to cell damage and could also cause the cells to burst. And now we've caused another problem. This is important, especially in the brain where rapid swelling can lead to increased ICP and even more serious complications. We would use this for a patient who is severely dehydrated from things like heat exhaustion or prolonged nausea, vomiting, diarrhea. Hypotonic saline can help restore fluid balance gradually and would be beneficial in situations like that. So back to our picture one more time. You can see in the hypotonic solution, the fluid outside the cells has a lower solute concentration than on the inside, which causes water to move in the cells, which makes them swell and potentially burst, which is what we see here. And so just to kind of bring it home with our fluids here, we have our hypertonic, isotonic, and hypotonic. Like we said, isotonic are primarily the fluids that we use in EMS because it doesn't alter that water balance shift within cells, and it prevents that osmotic stress. But hyper and hypo have their place. 3% saline, the hypertonic saline, is extremely useful with things like cerebral edema. 0.45% saline is very useful in patients with hypernatremia, which is a high sodium level. It helps slowly lower those sodium levels without causing some rapid change. The choice of solution, when we have the choice, can affect our patient's outcome. So, administering a hypertonic solution when not indicated could actually exacerbate dehydration, and hypotonic solutions, when not indicated, can lead to dangerous cell swelling. This is why we typically have isotonic fluids like lactated ringers or normal saline. Those are ideal for patients suffering from blood loss or dehydration, where no cell swelling or shrinking is desired. We just simply want to refill the tank, and that's what isotonic fluids are good for. But again, what does this have to do with EMS? Well, we already talked about how it's relevant for our fluid administration, and we've already kind of had some examples of why we would use these. So, firstly, hypertonic solutions, like we said, incredibly useful for cerebral edema, decreasing swelling of the brain. It helps draw water out of those brain cells, which helps decrease that swelling. Then we have hypotonic solutions used very effectively to treat hypernatremia. They lower the solute concentration in the bloodstream, and they help move water into cells and balance out that solute to water ratio. So if you've ever heard the saying, the solution to pollution is dilution, that's still true in hypernatremia. We're still using a solution to dilute the polluted blood, but that solution has less sodium because pollution is too much sodium. And then, like we said, isotonic solutions, very useful for a lot of different things. Really, our goal with isotonic solutions most of the time is to quickly replenish fluid volume. It's to really refill that tank to help. It also helps maintain electrolyte imbalances and really just restoring that blood volume. All right, and that is all I have for you for transport mechanisms. Like you've seen in this lecture today, transport mechanisms, although we don't think about them as much, we do think about what fluid to give, when to give fluid, why to give fluid. And again, if you just strip everything down to its most basic level at the cell level, transport mechanisms are what help us make those decisions. So thank you. Have a great rest of your day and good luck on the rest of your paramedic journey.